I'm Dr. S. Sandy Sanbar, and I would like to talk to you about electronic informed consent. Every physician is required by law to converse in understandable language directly with the patient when advising a treatment or procedure before signing an informed consent or, if refused, an informed refusal. The physician should also ascertain that the patient comprehends the alternative therapies presented and their risks in order to make an informed choice. Documentation of the conversation is an extremely important element of the consent process, which regrettably is often severely lacking. Patients often receive a generic consent to treat document or a fill-in-the-blank document to sign, which is frequently unread, resulting in either under-information or misinformation. The consent process should not be construed as merely a formality or a nuisance that serves to extend or delay the inevitable procedure. Instead, the consent or refusal process is an essential part of medically preparing and rightly empowering patients to take ownership of their situation. The process ends with the physician yielding to the patient's informed choice. Patient understanding is pivotal in the consent process. In 2010, Fink and co-workers investigated independent factors that are associated with improved patient understanding at 7 Department of Veterans Affairs medical centers. They analyzed computerized informed consents of 575 patients who were scheduled for a 1 or 4 elective planned operations, namely total hip arthroplasty, carotid endarterectomy, laparoscopic cholecystectomy, or radical prostatectomy. The authors found several significant independent factors associated with improved comprehension, including race, ethnicity, age, operation type, group assignment, and total consent time. The providers at the VA medical centers were prompted during the study to ask patients a series of 6 questions to confirm patient understanding, which is a technique of the National Quality Forum endorsed safe practices. Such prompting was facilitated by the electronic informed consent. The providers were able to quickly verify and document patient understanding of the major aspects of the contemplated procedure. The authors concluded, number 1, comprehension during computerized informed consent discussions may be limited in individuals with potential language difficulty due to ethnicity or education. Second, the total consent time was the strongest predictor of patient comprehension. The patient comprehension was maximized when informed consent took between 15 and 30 minutes. Third, the use of teach-back or repeat-back also significantly improved patient comprehension. In 2006, Issa and co-workers investigated the satisfaction of urology patients with informed consent. The authors found that 96 preferred the electronic process to a traditional paper-based informed consent process. The authors concluded that employing electronic tools to assist with informed consent is a valuable asset to efforts to improve efficiency, reduce risk, enhance safety, and ensure patient satisfaction. 21st century physicians and other health providers are required to contain cost, provide high-quality medical care, and adapt to highly technologic advances while at the same time being burdened with increasing federal and state laws and regulations, electronic health records, integrated health systems, accountable care organizations, and electronic informed consent. Electronic health records often incorporate electronic informed consent software to prepare detailed patient information packets aimed at educating patients about planned procedures. The packets are given to the patients before the procedure, either on paper or electronically. They include comprehensive and easy-to-understand procedure-specific consent forms. When the informed consent software is integrated into the electronic health record or practice management system, it relieves physicians from preparing a note describing completion of an informed consent discussion in the electronic health record. The informed consent software that is part of the electronic health record will automatically generate a separate detailed completion note in the medical record in addition to the signed consent form. Physicians who obtain informed consent electronically do so at workstations, tablet computers, and mobile point-of-care devices which display the procedure-specific information and forms. That makes for efficient use of the doctor's time. Patients and their families who fully understand through excellent communication the complete range of complications that may result from a procedure ultimately helps minimize risk and reduce liability. After being provided with the understandable information, the patient signs the electronic informed consent or refusal with a retail-style digitized signature capture pad or by using the stylus on a tablet computer. Automated informed consent tools ensure that digitized images of signed consent forms are available to the operating room staff for the pre-procedure verification and for the timeout. In contrast, paper-based informed consent forms can easily be lost or misplaced. It is preferable to obtain the electronic informed consent in the physician's office rather than the preoperative holding area. The process should be completed well before a patient arrives at the hospital or surgery center. Web-based tools can prepare specific electronic informed consent documents with a hospital's template that describes in details the procedure, risks, benefits, and alternatives that are unique to the treatment or the procedure planned for a particular patient. Informed consent software tools may also provide both detailed pre-procedure instructions and comprehensive discharge instructions which patients like. These instructions serve to reduce readmissions. Some software allows patients and physicians to review the electronic informed consent information and instructions together on a computer screen. Patients may also take a detailed document home to review at their own pace with their own family members. And every provider in an integrated health system may easily access and check the signed electronic informed consent form with a patient's electronic health record and answer questions that may arise. The cost of an office-based informed consent system is generally less than $1 per day. Professional liability insurers and professional medical organizations may provide these systems at a discounted price. Thank you.